I'm Nick Altmeyer with linkinglewiscounty.com. We're here this afternoon with Anna Platts from Lewis County Public Health, and we also have Kelly Adsett here, who is part of the diabetes prevention program. So Anna is here to promote the program, which is starting a new round on February 7th. So if you want to just explain to people a little bit of what the program's about.
Sure. So Lewis County Public Health offers a free lifestyle change program to Lewis County residents. It's technically called the National Diabetes Prevention Program, but we like to consider it a lifestyle change program. We offer new classes about every other month or every 2 months or so, and eligible participants are those who have blood work in the prediabetes range, or those who score a 9 or higher on a very simple risk test that you can find right on our public health Facebook page. This program, the overall goal of the program is for individuals to lose about 5 to 7% of their body weight, because we know that for those individuals who are pre-diabetic, losing that weight can significantly reduce their risk of developing diabetes. So we spend a year together. This program meets weekly for 1 hour for 16 weeks, and then goes to bi-weekly for about 2 months, and then we meet monthly for 6 months. So we gradually, well, first we throw a lot of information at you, and then we gradually wean you off so you become better self-managers yourself and build your independence. Okay,
so we have the new class is starting on Thursday, February 7th. So the classes are generally in the evening, and they're held this particular one is held at Lewis County Public Health in the conference room?
Correct. We try to accommodate as many working individuals as possible. So typically the class will meet from about 5 to 6 p.m. But if we find a group that the need is to have a later class or a class at a different time of the day, eventually we can try to accommodate that if we can find enough interested individuals.
Okay. And so, Kelly, you're currently enrolled in one of the classes that's ongoing at this time. So, like Anna said, that you guys try to start a new class every couple of months.
Correct.
And so this will be a new one that's starting on February 7th. So, did you want to talk a little bit about some of the things that you guys go over in the class? Some of the ways that it's helpful for people?
Sure. I was very, very excited to become a member of the class. I knew that I was in desperate need of some help. I was at my all-time heaviest weight. I wasn't feeling well, and I happened to meet Anna one day, and she told me about the program, the free program, and it really is a lifestyle change, and it has been immensely helpful. One of the things that it taught me, I had no idea of the amount of fat that I was consuming. I thought, oh, I'm eating pretty healthy. I eat a lot of vegetables. I eat my dairy group. I thought I was doing the right things, and I consider myself a pretty active person. I walk a lot, but this actually made me more mindful of what I was doing, and it's really helped me. I've lost over 7% of my body weight so far, and I'm more, like I said, I think mindful is the best word to say what has happened with the program. And it's also a very supportive atmosphere for us. We started right before the holidays, so we had Thanksgiving, we had Christmas to deal with, and it's a life changer. It really is.
And that's one of the points I was going to bring up and ask about, was probably like when you have multiple people doing the same thing at the same time, it's kind of builds a support network as well for all the participants that are.
Oh, absolutely. It's an evidence-based program, so it's proven to work. So there is a curriculum we have to follow, but my coworkers and I who lead it, we often tell them, I mean, we guide the instruction and the facilitation, but they learn from each other, and they're the ones doing the work, and it is fascinating. We learn something new every class that we hold.
Okay. Now, I know you said that people that are pre-diabetes, as far as like indicated by a blood test or taking the short survey, what kind of people are in that category? Do you have so maybe somebody doesn't have the blood work, maybe somebody's just sitting at home and doesn't know if they're pre-diabetic or not. What are some symptoms and signs, and what can you be looking out for to maybe get that checked?
So in regards to being at risk for pre-diabetes, your age can be a specific range. If you are older than 65, you automatically can qualify to participate in this program. We have a risk test that we follow, and there's different points to different value statements. So whether your parents have diabetes or you have siblings have diabetes, if you had gestational diabetes when you were pregnant, that is also considered a risk factor. If you are between the ages of 45 and 65 and lead a pretty sedentary lifestyle, that's also a risk factor. So you'll find that many of our residents are eligible to participate in this program. It's not very difficult to qualify, and honestly, I think just about anybody could benefit from the information that this class has to offer.
Okay. And so obviously not everybody has the same level of understanding of diabetes and how it affects you and what it can do. So what is the importance of getting it diagnosed early and or taking these steps to prevent having it in the first place?
Absolutely. The prevention part is key. If we can catch people in that pre-diabetic range, like I mentioned before, just reducing your weight by a certain number of pounds or percentage, like for an individual who is say 200 pounds, about 5 to 7% of their body weight is a weight loss of about 10 to 14 pounds. But that small weight loss can reduce their risk by half, their risk of developing diabetes by half. But we also know that when people do fall into the diabetic range, that is when your risk for heart disease and stroke skyrocket astronomically. And we do offer a diabetes self-management group for those individuals who are already diabetic, but that curriculum is completely different. So we have ways to support you in both ways, but the opportunity to prevent diabetes in the first place is what we're trying to capitalize on.
Okay.
One of the other advantages of the program too is you will find that there are some surprising results. I've noticed better balance, increased energy. My joints don't hurt as much. So it's overall, the whole program is so nurturing and supportive and educational. I cannot say enough good about the program.
So can you describe a little bit about what's an average, so generally when you guys get together, it's for an hour at a time. So generally what happens during that hour that you guys are meeting in?
Well, we start or end with a weigh-in, and they track our exercise to make sure that we're getting so many active minutes a week. Then there is the informative piece, and they give us tips on things that we can do to, like dietary tips or ways to tip the scale in your favor. I'm trying to think what else. A lot of feedback from around the table, which is encouraging and supportive. Yeah.
Things that work for some people, and they might share.
Oh yes,
with each other.
And that's actually kind of a fun piece of it. Is as people start saying, "Oh, well, I've tried this, and this was successful for me," and anything from different exercises people might share, or ways to get over if you meet sometimes you plateau, and so ways to get that going again.
Okay. And how many people are in one of the programs at any given time?
We shoot for about 10 to 15 to start with, because we know and understand that life does happen. But like Kelly has said, it's that environment and that supportive core group that really encourages change. So we really try to have about 10 to 15 people per session. And we're really excited because in this new year, and this is the first group that has it being offered, we received some funding to offer incentives for participants. So if you meet the attendance requirements for the program the whole year long, which is daunting at times, but really necessary, participants will have the option between a free Fitbit Zip or a 2-month gym membership.
Okay, perfect. And do... I had another question and it totally slipped my mind. How many people, like, okay, so you start a class with 10 and 15, do most of them generally make it through to the full year, or do you see like a drop off in some of the classes, or? It
varies from group to group. The core sessions are really information overload and heavy, so we usually see pretty good attendance through those first 16 weeks. Eventually things will trickle down. I mean, we start them at all different times of the year. People will go away in the winter, but we try to accommodate people and their life in any way we possibly can. We have a woman in the class who's in Florida right now, and we're sending her information and via email, and she's sending us her activity and food tracker. She's sending it back to us.
Perfect.
But yeah.
And as far as what happens at the end of the program? So after the year is complete and the people have made it through the program, at that point they've probably made a lifestyle change after being involved in it for a year and having that support group. So is there follow-up after the program's over, or?
They're always welcome to call Lewis County Public Health and check in. While it is a year and most of the weight loss occurs during that year, the goal is really to then keep it off. So we have some participants that are able to do that, but we also have others who have come back and taken the class again for a second session because they like the accountability. They enjoy the opportunity to both socialize and learn from each other. So it varies from person to person, and that's okay.
Okay. So we've given people a lot of information about the program, and we really thank you for coming in and sharing a little bit of a first-hand perspective on how the program works and the good effects that it has on people. So how do people go ahead and sign up for the program, so now that we're to that point?
So you can self-refer or be referred by your primary care physician. They are aware of the program. And if you get that blood work, they can refer you, but you are also welcome to call Lewis County Public Health at 376-5453 anytime to receive more information, to fill out the risk test with one of us, or if you're curious before calling, you can look right on our Facebook page or our website and see the risk questionnaire.
And what's the website for public health?
linkinglewiscounty.com.
Okay, that's easy enough. Yeah. Okay, and again, the program is free. So this particular session of the program is going to be kicking off on February 7th from 5 to 6 p.m. And that's every Thursday for 16 weeks. And then, like you said, there's the 4 bi-weekly sessions and then the 6 monthly sessions after that. So basically, it works out to be a year. And then you guys meet right at the conference room at Lewis County Public Health, which is right over at the hospital.
Correct. It's in the second floor of the children's building, so right up near physical therapy in the rehab department.
Okay, perfect. Did you have anything else to add today, Kelly?
I guess the other thing I want to add is it also offers you a chance to eat out at restaurants too. It helps you know what to do in those type of situations and social gatherings, and it really is a lifestyle change, and sign up. You'll be glad you did. I am.
Okay, great. Well, we thank both of you ladies for stopping in this afternoon and explaining a little bit more about the program. And for any more questions, you can call Anna here at Public Health.